this workshop today, and we will send out an email afterwards in a few days with the recording, and you're welcome to share it with anybody you like. So welcome to this month's webinar with Summit Financial Advisors called Medicare Made Easy. My name is Glenelle Jordan. My partner on the call is Kelly Tom. And our guest speaker today is Taryn Kumamoto. She is a Medicare specialist, and she will be leading the majority of today's workshop. Every month we do webinars on different topics. So next month you will get an email for our next webinar. And if you ever want to see what's upcoming, all you have to do is go to our website, summitfinancialhawaii.com. On the top, click on workshops, and it will tell you the next workshop. Also, you can always go to our YouTube page where we have recordings of all of our monthly workshops as well. So this workshop will last for about 45 minutes. Here, we'll periodically check the text, so the question box. So if you have any questions, type them in there and I'll try to interrupt Taryn and get your question answered. But you can always take down her contact information that you see right there and contact her directly. We've known Taryn for many years. She's an excellent resource. She's super helpful. She's helped a lot of our clients. So I think if you're right around this age of Medicare, you're going to find this workshop really interesting. So I am done speaking. So Taryn, take it away. And thanks so much for doing this for us.
Of course. Thank you so much, Kelly and Glenelle, for having me for, I don't know how many presentations we've done, but I'm always happy to be here and share with your clients and their friends the Medicare information. So let's get started because there's a lot of info to go over today. So my name is Taryn Kumamoto. I'm with an agency called Premier Benefit Consultants. So it's a Medicare brokerage agency. And as you can see, I've been in the industry since 2008. So about 13 years now. And the plans that I offer or that I represent are HMSA, United Healthcare, also known as AARP Medicare plans, Humana, and Aloha Care. So each agent is an independent agent. We're licensed and contracted with the different vendors. So, which is nice because that allows us to talk about the different plans. So you have to be licensed with the carriers in order to talk about them. I was a financial advisor before I was an insurance agent from 2008. So that's why I like to help a lot of the financial advisors and their clients because I've been an advisor before, and many of you folks have questions on the health insurance side. Maybe not so much the investment side now, but the health insurance side, because that those are some of the costs that are unknown, right? But I can help you get a better idea of what your out-of-pocket expenses could be. I graduated from Chaminade with my master's in business with a focus on finance. And before that, BBA in business administration from the University of Hawaii at Manoa. I'm a Kailua High School graduate. Go Surf Riders. And my Ohana life, I'm married. I have 2 children, ages 8 and 6. Very busy mom, wife, and we take our kids to a lot of sports activities. And fun fact, so I'm gonna try and keep you happy and lively and upbeat because I was a cheerleader. So I cheered for Kailua High School, I cheered for UH Manoa. So I know Medicare is such a boring topic, but I'll try to make it a fun topic today. So thank you so much for joining us. Next, the agenda. So we're going to talk about the rising costs of healthcare, the basics of Medicare. So what is Medicare? When are you eligible? When can you enroll? What are the different parts? They're called parts A, B, C, and D. And how to complete your Medicare coverage. Should you purchase a Medicare supplement plan, also known as a Medigap, or a Medicare Advantage plan? So just remember, 2 very different products. You cannot have both at the same time, and we'll get more into that. So with the rising cost of healthcare, healthcare spending in the United States is a $3 trillion a year cost based on a 2018 study. So CMS, which is also known as Center for Medicare and Medicaid Services, projects by year 2028 the cost will climb to $6.2 trillion a year. And there are three key factors driving up the healthcare costs. Number one is the prescription drugs, two, chronic diseases, and three, unhealthy lifestyle. So I know a lot of members, when they come off of their employer medical plan, the prescription drugs is really key because the employer medical drug plan, the pricing and the cost is very different from a Medicare Part D plan. Your Medicare Part D prescription drug plan, you will more than likely pay more for your co-pays than if you were on an employer plan. So keep that in mind, because as you transition over, you're going to see some costs, and it may be an extremely higher amount of co-pays for your medicine. With chronic diseases, and of course, with your someone's lifestyle that's unhealthy, that's gonna drive you to see the doctors more. You need more care and more services. And so your out-of-pocket costs can increase. So if you don't have the best plan for you, you may find yourself in a lot of out-of-pocket expenses. So why do we need to talk about Medicare due to the rising costs? Because Medicare is health insurance, and this is where you're going to decide, should I pick up a Medicare supplement or advantage plan? So please remember, Medicare is a federal health insurance program. The federal government funds Medicare through your payroll tax and contributions known as FICA. So if you or your spouse worked for an employer and you see the word FICA come out of your payroll, so a portion of your FICA tax is paying towards your Medicare Part A. So Part A is hospital. And so as long as you work your 10 years or 40 quarters, your Part A, when you're ready to collect your Medicare Part A benefit, is premium free. It's not benefit free, it's premium free for Part A hospital. So to qualify for Medicare, you are a US citizen or legal resident who has lived in the United States for at least 5 years, consecutive years, and you or your spouse worked the 10 years or 40 quarters in the United States and are age 65 or over. Or you could qualify for Medicare based on supplemental Social Security disability that you're collecting, that you have collected for 24 months or longer, if you're under age 65. Or if anyone with ALS, Lou Gehrig's disease, or kidney failure, which it's called ESRD, end-stage renal disease. So if you're diagnosed with ALS or ESRD, and of course you could be any age, then you would qualify for Medicare as well. Okay, so those are the different qualifications. To enroll into Medicare, initial enrollment period, the first column, this is when someone is preparing and they're going to turn 65. So yay, that's a big benefit. Turning 65 is because now you're eligible for Medicare. So again, Medicare is health insurance for people age 65 or over, or could be younger with qualifying disabilities. So it's a 7-month period, meaning 3 months prior to your 65th birthday is when you can apply, start to apply. Also, if you forget to do it that month or those months during your 65th birthday, you can apply. Let's say you forget your birth month too. Then you have 3 months after your birth month to apply for Medicare A and or B, or both B. So it's a 7-month window. And I always get asked, Taryn, so I'm going to turn 65, but I'm still going to work and I have employer medical coverage. Do I still need to enroll into Medicare? So the answer is yes, you need to enroll into Medicare Part A, at least Part A, because that's hospital. And again, hospital, if you work 10 years or 40 quarters, then that's premium free. So why not, right? Because if you work 10 years or 40 quarters, you have Part A premium free, then you'll just have dual coverage for a hospital. Then you could possibly defer Part B, again, if you have employer medical coverage, but that depends on if you work for an employer that has more than 20 employees or less than 20 employees. If you work for an employer that has less than 20 employees, then Medicare says you should sign up for both Medicare A and B. The next column, special enrollment period. So to avoid any penalties, anytime you're still covered by your group employer Medicare plan, you can sign up for Medicare A and B. But let's assume you were Akamai and you turned 65 and you signed up for A, right? And you deferred B. So now you're 70 years old and you're ready to retire. So you can sign up for Part B while you're still working. So you're ready to go when you retire. Your Part B is activated the month after you lose employer coverage, and I will help you with that. The second bullet is during the 8-month period that begins the month after your employment ends or coverage ends, whichever happens first, you will not have a Part B penalty if you pick it up within the 8 months. Okay, so I know there's so much information, but if you, and this happens because I've been doing this for so long, that people retire and they end up taking not Medicare B, but what do you think, you folks? They end up taking COBRA because they didn't know about their Medicare option. So some people take COBRA, which is very tricky because you may not have prescription drug coverage on it, or you may have it. But COBRA is a very touchy subject because we want to be sure that it has credible prescription drug coverage. If not, then you could have penalties for the Part D, the drug side. So anyway, that's special enrollment period that you could pick up your Part B and D. But the D now is not part of that 8-month period. That's only for Medicare Part B, B as in boy, okay? For part, if someone is gonna take, or say forgets to pick up or delays their Part B, then I want to be sure that they have a prescription drug coverage, and that you have to pick up within 63 days. It's a Medicare Part D plan. And then the general enrollment period, the third column, if you forget to pick up your Medicare B, you can pick up the general enrollment period time, which is January 1st to March 31st, but the coverage won't start till July 1st. And then you might have penalties, right? Because you didn't pick it up when you were supposed to. What are the penalties? So write this down. Part B penalty is 10% times a full 12-month period you didn't have it. So if the base premium of Medicare Part B is $148.50 a month, and I say base premium because the Part B is related, that amount or that figure is related to your 2 years prior income tax return. So if your income tax is higher, there's this PDF I have, I'll try to share that later. But if you're higher income, your Part B and D will be higher too. Okay, so that's the general enrollment period. You might have, I'm sorry, the penalty is 10% for a 12-month period for Part B. And then Part D, as in David, or for drugs, the penalty is 1% times the number of months you didn't have a Part D plan times the average of, it's about $35 a month is an average Part D drug plan. If you calculate those figures, the 1% times the number of months you didn't have a Part D times $35 on average, then that will equal the monthly penalty that you will have. And the penalty, guess how long the penalty lasts for, you folks? If you said for a lifetime, then you are correct. So yes, it's a lifetime penalty for Parts B and D. Okay, let's move on because I want to make sure that you don't spend any more time with me than you have to, right? Okay, original Medicare. So original Medicare is, see this card, this red, white, and blue card. So Part A is hospital. It's 0 premium per month. Of course, you have to be, the premium is 0, but you have to be qualified for it, meaning you had the 10 years or 40 quarters or your spouse did. It covers inpatient hospitalization, skilled nursing, home health care, and hospice. It is premium free, but not benefit free. So let me repeat myself. It's premium free if you are eligible, but it's not benefit free, meaning when you go to the hospital, it's not free. You still have to pay something. And I reiterate this many times because a lot of clients, and of course, you're brand new to Medicare. What do you folks know? You're coming to us as experts. You're calling Medicare. You're reading this book, which not too many people read this book. But in other words, you have a deductible of $1,400 and you have co-insurance still yet. As you can see, $371 co-insurance per day for day 61 to 90. And then days 90 and beyond, $742 co-insurance per each lifetime reserve day after day 90. So you have a 60 lifetime reserve days. But after that, then you pay 100% of your hospital costs. So the downfall of original Medicare is that you could be paying a lot more because there's no cap, there's no ceiling. You just keep paying your deductibles and your co-insurance. So next we're moving on to Part B. Part B medical, we call it, which is doctor visits. So it's $148.50 a month. That's the premium, again, dependent upon your 2019's tax return, because this is year 2021. So they will look at your 2 years prior tax return. And you have a $200 and 3 Part B annual deductible. Okay, so you have a premium, you have a deductible, and you see the first bullet, then you pay 20% of the co-insurance. So Medicare covers 80%, you would pay 20%. So this includes services for doctors, durable medical equipment, other medical and preventive services. And there's the last bullet. So higher incomes pay more for parts B and D. What is not covered under original Medicare? Routine eye exams, eyewear, dental, hearing exams, hearing aids, cosmetic surgery, long-term care, unless you're qualified by means of Medicaid status. And medications, prescription drugs is not covered under Part D. Some medicines are covered under Medicare Part B, B as in boy, but those are usually done in the doctor's office. So I'm talking about pharmacy, retail pharmacy, prescription drugs that you pick up at the pharmacy, that is not covered under Medicare A and B. So again, just to recap, this card here, Medicare Hospital A and B, that's it. It's only Hospital A and B. You have deductibles, you have co-pays, you have co-insurance. These are the things listed that are not covered. And lastly, sky's the limit, meaning you can just keep paying whatever your bill comes in. So if you have a bill and it's a Part B service, you know, on average, you're just going to pay 20%, but 20% of the unknown. That's why you want to have something else besides just original Medicare. So if you are fortunate enough to have worked for a union or someplace, maybe the federal, city or state, where they give you a retiree medical, then you're set. You have Medicare A and B, and you have your retiree medical coverage, then you're good. But if you don't, like a lot of us, when we retire, we may not have a retiree medical plan. So therefore, you definitely want to pick up a Medicare Advantage or a Medicare supplement. And we're going to go over that really shortly. So here we go. These are all offered by private insurance companies, and it's either called a Medicare supplement on your left, also known as a Medigap. Plus, you would buy a Part D prescription drug plan, or you buy a Part C Medicare Advantage plan. So write in your notes, Taryn said, I'm either going to pick up a supplement with a Part D plan. So you have to buy 2 plans, supplement plus a Part D, or a Medicare Advantage plan. You cannot have both Medicare Advantage plan and a supplement plan. That's not allowed by the government. Okay, so it's either or. So for you folks that like visual, like me, I like visual, this is what it looks like. So you have Medicare, original Medicare on the top, and you're gonna buy a supplement and a drug plan on your left side. So I would say maybe that's called option 1. And then option 2 is you purchase a Part C plan. Okay, let's move on. So let's focus on the left side, which is option 1, the Medicare supplement plans. So the supplements started in the 1980s, and they are offered by private insurance companies. They're also known as Medigap, and there's 10 standardized plans, and premiums usually increase yearly. It helps to pay for some or all of the out-of-pocket costs that original Medicare doesn't cover. It's a supplement to only Medicare Parts A and B, meaning it's only a supplement to hospital and medical. There's still no drug coverage in a supplement plan. That's why you have to buy a separate Part D prescription drug plan. And there's usually no extra benefits like free gym membership or chiropractor and acupuncture, 20 visits a year. Those extra benefits you might see on something called a Medicare Advantage plan. Moving on, I have so much information. Option 2, Medicare Part C Advantage plan. Now, looking at this screen, I know it looks like, okay, so we have original Medicare, right? And then you have Part C. But in this case, please remember that your Medicare Part C Advantage plan, so let's just say, it's XYZ company and this is the card. When you purchase a Part C plan, all of your benefits of original Medicare A and B are now inside your Part C plan. So you're only going to show one card. Okay. So again, when you join a Part C plan, you're still part of original Medicare, but because it's through a private insurance carrier, the private insurance carrier says, okay, we're going to take everything from original Medicare, your A and B, but now we're providing those benefits to you. That's why you only show one card. Okay, you only show your Advantage plan card. To give you more detailed information, your Part B premiums that you're paying for to the government, the $148.50, that in turn goes to your Part C Advantage plan. Okay, so please do not think you have dual benefits or dual plans, because you don't. You only have a Medicare Advantage card. Okay, the other way here, the supplement plan, right? Option 1, yes, you're going to show 3 cards: your original Medicare card, your Part D card, and your supplement card. Okay, if you're going to do a Medigap plan. So with the Medicare Part C Advantage plans, these were created in 1997, but the plan sales didn't start till 2006. And I started in the business in 2008. So I came in right after they started selling the plans. They're offered through private insurance companies. Here it is. The Advantage plan pays instead of original Medicare, covers all the benefits of original Medicare, but they make their own, they put their own benefits on there. So you would just look at your plan benefits. And they may include extra benefits, maybe dental, vision, hearing, emergency coverage outside the United States. And they may include Part D prescription drug coverage as well. Some Part C plans have drug coverage included. Some Part C plans do not. So you really need to make sure on choosing the plan that you want. You must continue to pay your Part B premium, and this is important. You must continue to pay your Part B premium. So if your Medicare Part C Advantage plan has a premium, you will pay 2 premiums. Number 1, your Part B, right? Everyone has to pay to Part B unless you're getting Medicaid. Medicaid is state assistance. And number 2, your plan premium, plan to your Medicare Advantage plan, okay? Because you have to have both Medicare A and B to enroll to have a Part C plan. You only show your Part C card, which we talked about. The biggest benefit is there's a built-in safety net. There's an annual maximum out of pocket, meaning if something major happens to you on your Advantage plan, there's what we call a maximum out of pocket. Say, for example, it's $6,700. So for the year, an annual amount, $6,700 or whatever your plan states, If something major happens to you, that's the most you would pay for hospital and medical. Prescription drugs has a separate maximum out of pocket we call catastrophic coverage. Okay, so this annual maximum out of pocket you have for your Part C plan is your hospital medical, and then you also have another annual maximum out of pocket for your Part D drug plan. It's best to use network providers because using network providers means your co-pays and co-insurance will be lower than if you paid an out-of-network co-pay or co-insurance. You may qualify for financial assistance. So if your income and assets are under a certain amount, then your Part B and even your plan premium, you may be able to pay less because you may qualify for financial assistance. So you would need to apply for the financial assistance through Medicare.gov, and then also, actually, no, it's only through Medicare.gov and possibly your state Medicaid assistance program. Lastly, if you enroll in Part B or D, you may incur late enrollment penalties, which we went over, right? And a Medicare supplement plan is not a Medicare Advantage, which we went over that. I know you folks are taking great notes. So here's a summary. So Part A, we call original Medicare. Again, Part A is hospital. It's premium free if you're eligible. There are deductibles and co-insurance. Remember, Taryn said it's not benefit free. Part B, medical, doctor visits, outpatient, right? So it's $148.50 a month, but it depends on your income. If you're high income, then you're going to pay more. There still are deductibles and co-insurance. There's an unlimited maximum out of pocket for the consumer, meaning sky's the limit, right? If they say, oh, Mr. and Mrs. So-and-so, here's your bill, 25,000, 50,000, you pay 20% of that possibly. So it's an unlimited amount. And also there's no Part D prescription drug coverage. So that's the first column, original Medicare. So you see there's a lot of limitations there. And there's a lot of risks if you don't have a retiree medical plan on top of that. The Part C Advantage plan, which is through private insurance carriers, we like to call a bundled plan, which includes Medicare A and B, and most times Part D, which is drugs. The premiums vary by the carrier, so it could be anywhere from zero premium, $50 a month, up to another $180 a month premium. But remember, you always have to pay the plan premium plus your Medicare Part B premium, okay, unless you qualified for Medicaid. Medicaid is state assistance. There is an annual maximum out of pocket, yay, meaning if something major happens to you, then there's a cap, there's a ceiling, right? So that's the biggest benefit of a Part C Advantage plan. And then it also may include extra benefits like vision, chiropractor, acupuncture, free gym membership, which a lot of people like. If you don't want to go to the gym, that's fine too, because a lot of the plans, these Part C plans, offer a home fitness kit. So you can get 2 free exercise kits, usually maybe like a yoga kit, a strength kit. I forget, there's about 30 different kits, I think. And you could get 2 a year for free, and it's mailed to you. And the last summary we're going to go over is the late enrollment penalties, because this is important. So the Part B, you pay 10% of a full 12-month period that you didn't have Part B on. And so, for example, $148.50 is the Part B premium, right? The base premium. So if you didn't have Part B for a year, then you pay 10% of that. So you add on $14.85 every month to your $148.50 premium. Okay, but you add that on every month for life. It's not a one-time payment. Okay, it's for life, for as long as you have Medicare B. Medicare Part D, the late enrollment penalty is 1% times $33, or I mentioned $35. It's an average. And again, that monthly amount will come out to your penalty. That's going to be added on to your Part D premium. Same thing. It's for as long as you have that late enrollment penalty that the premium will be on. So completing your coverage, how much does a Part C Advantage plans cost, which we went over? So it varies. You need to look at the specific plan. And, you know, in this book here, your Medicare 2021, in the very back, there's a cheat sheet of the plans in Hawaii. So on page 120B, it says Medicare Advantage plans in Hawaii. So it has a different carriers and a different pricing. So I would definitely look into this. Or you can call me. I'll be happy to help you go over that. And then how?
Taryn, we have a question.
Oh, yes. Sorry.
What if you ready? What if you have TRICARE for
Oh,
life?
okay. Yeah, good question. So I have many clients that have TRICARE for life. So TRICARE for life, as you folks already know, you have to have Medicare A and B to qualify for TRICARE for life. And then my clients who do pick up, we usually pick up a zero premium Advantage plan. Because your TRICARE for life, you're gonna go to your side, right, to pick up your medicine. Well, let's say if you're using your military doctors, then you're gonna stay on that side, use your original Medicare and TRICARE for life. But if you want to use civilian doctors, you can as well, and then you will bill that. Oh, you know, I'm sorry. If you only take your TRICARE for life, that's fine, right? But sorry, I'm coming from the point of you're gonna do TRICARE for life and an Advantage plan. So if you decide to pick up an Advantage plan, which by all means you don't have to, but this is what some of my clients do. So they pick up a Part C Advantage plan. When they pick up a Part C Advantage plan, please remember that's going to take the place of original Medicare, okay? So you're not going to have 3 coverages, you're only going to have 2 because your Advantage plan is your Medicare plan, right? So now it's going to be your Advantage plan, Part C, is going to be primary, and then your TRICARE for life is going to be secondary, okay? And so you just show, when you use your TRICARE for life, show both cards, your Advantage card and your TRICARE for life card. But I haven't had any problems with that. You just need to make sure that you give them that card.
Another question is that book you're holding up. So how can people?
Okay, this book, you can get it if you are turning 65. You have to be Medicare eligible. So if you're turning 65 or if you're under 65 because you qualify for disability, this is the only way you're going to get it. You might have to borrow your friend or family member's book. Hopefully they don't throw it away if you want to read it before. Or you can go to medicare.gov and just type in the search bar, Medicare and you, and the 2021 handbook will pop up. However, it's not going to be the Hawaii book. The Hawaii book is mailed to people, right? So you're not going to see this lovely page. You're not going to see that page. It's going to be blank, but you have everything else in there, but you just won't see the Hawaii benefits. Does that answer your folks' question? So you'd have to get somebody's book to get the Hawaii information in the back.
Yeah, that's a good answer.
Yeah.
Thank you.
Yeah, thanks for asking. Mm-hmm.
No other questions at this time.
Okay, but ask away. How much do the supplement plans cost? So the supplement plans are based on your age. So you need to give me your birthday and then I'll tell you, okay, at age 65, it's maybe $130 a month for one of the better plans. Because there's 10 different plans, there's different premiums, right? So of course, the better the plan, the better the higher the cost. The less coverage plan on a supplement, the less cost it is for you. But I can help you with that. Usually there's only 2 plans we're looking at, G or N. So again, Medicare supplement, G as in girl, N as in Nancy. So G would be the most comprehensive plan. And N would be not as comprehensive, but the premium is doable because you don't need as much coverage. Okay. So there's a lot of information that I'm going to ask you. And if you don't mind sharing with me, your names of your doctors and then the list of your medicines. So that's what I first ask you when we have a conversation on the phone. I'm happy to meet with you in person or still over the phone. A lot of times I do phone. We don't even do Zoom anymore because I think we just, have it on speakerphone and we talk. But whatever you folks prefer. Again, before I forget, so of course, if your friends or family or you are retired city or state, you do not need any of these supplement or advantage plans. In fact, if you pick them up, it may bump you off of your retiree medical plans. We don't want that. If you have a union plan, you don't want to pick up these plans because it may bump you off your retiree union plan. So this is for people who TRICARE for Life is okay. Federal retirees is actually okay, but you have to have Medicare A and B. I have a lot of federal prospects come to me and they say, oh, Taryn, I listened to your presentation. I like that Part C plan, it's zero premium. Why not? But when I asked them, do you have Medicare Part B? They said, no, we never picked it up. So unfortunately, you cannot pick up a Part C until you have Medicare A and B. And for some of the feds people, they decided to not pick up B because they didn't need to. Their federal retiree plan is fine, right? So in this case, I tell them, well, you cannot pick up a Part C because you don't have Part B. And it makes no sense for you to pick up Part B now because you're going to be subject to all these late enrollment penalties. So they agree that they're not going to pick up B, therefore they can't get C. Okay, so every person's situation is different, and I'm happy to help explain to you, your options. And then lastly, how do I decide which plan to join? We went over advantage plan, we went over supplement plan, but it's really depends on what's important to you, your medicines, your doctors, and what kind of coverage do you want? Do you want full Cadillac coverage where you're willing to pay possibly a higher premium to have higher coverage? Or are you in the area where you're like, Taryn, I don't take anything. I maybe go to the doctors 3-4 times a year at the most. Maybe I'm on a budget. I don't want to or need to spend that kind of premium. So then that's where I'm going to help you say, okay, well, maybe let's look at X, Y, and Z advantage plan or X, Y, and Z supplement plan, but a lower premium plan. Okay. So that's what we go over in our meetings. So that's it for now. Oh, yay. We can open it up to, I'll keep it short, but open it up to questions. And if there's something that you want to share with me personally, then please email me and or text me, or actually both is better. But we can go over your personal questions, but we can open it up to the group for now if you folks want to share anything with everyone. Thank you for having me.
Thanks, Taryn. No, I don't see any other questions, but that was great. Maybe if you want to go back to the first slide so people see your contact info if they want to jot it down really fast.
No, can I just?
Or not. It's okay. You guys can always email me. I'll get you her information.
Look at me, I have to go to every slide because.
Oh,
is it that one?
No. One more back. There you go. So this is her contact information. If you're too busy to write it down now, you can just email either Kelly or I, and we'll get you in contact with her. We'll probably do these Medicare workshops probably every 6 months because people are always turning 65 and they're really helpful. I always learn something new and it's really hard to remember everything. So it's really great we have somebody like you as an expert to turn to because we certainly are not experts in this area. Anyway, so for the callers here, thank you so much for being on today's call. In a few days, we're going to get this uploaded onto our YouTube channel and we will send out the recording. Feel free to share it with anybody and refer Taryn if for a friend or family. And look out for our next month's webinar's topic via email. You'll probably get it in the next few weeks. We're still trying to decide what topic we want to do, so I can't tell you what it is yet. And then you can always go to our website, summitfinancialhawaii.com, click on workshops, and you'll see what's there. So with that being said, there's no more questions, so we can wrap it up and keep it nice, short, and sweet. So thank you so much, Taryn.
Great. Thank you, folks. Thank you, everyone on the call, for your time today. Really appreciate it. Thank you for having me, Glenelle and Kelly.
Bye.
Bye. Aloha.